Basically, this is a lecture on the basics of biosafety. As I have already emphasized in the previous two lectures, that we are going to face certain challenges which are much more different in nature to the outside community, and we are at increased risk of infections. So all of you already know this symbol, right? That is the biohazard symbol. So you are going to face lots of biohazards in as a student, as well as when you start working from internship onwards, intern, resident, doctor, etc. So these are the concepts which are being taught to you in the first year, and it will stay with you for almost the rest of your career, so to speak. Okay, so be attentive. It's a morning lecture after Sir gave a very nice introduction to community medicine. So apart from taking care of the community, you need to take care of yourself as well, right? So these lectures will help you in that sense. So the objective of the lecture is to understand the principle and practices of biosafety. So to just start it off, I would like to play or dedicate a song to all of you. बचना ऐ हसीनो तो मैं आ गया ए बचना ऐ हसीनो. Okay, so it is not me singing, it is the pathogens which are singing for you, and it's not only applicable to all the hasinos who have joined, but also to the divanos. It does not spare anyone. The pathogen is not going to spare you in the next whatever period you are with us. Okay? So please remember this. Everyone knows this person? Kaun hai? Identify. Thanos. Is he the most deadliest person you know? Who is more deadly than him? Yes, so I'll show you another deadlier person. See this. This is what actually happens when a person coughs, sneezes, or even talks. So these are known as the droplets and aerosols. So this is actually the person. We don't see this in normally. But when you apply the infrared cameras, then you can clearly see there are some particles which immediately drop down due to gravity. These are the bigger particles. They are bigger than 0.5 microns. They are heavier. So they settle down immediately. These are known as droplets. Okay. And there are some very small particles which are less than 0.5 micron in size. These are known as aerosols or droplet nuclei. Why we need to know the difference between the two? Last 2 years, you have been hearing social distancing, hand hygiene, etc., etc. Ever wondered why do we need all this? Why do we need hand hygiene for a disease which affects the respiratory system? क्या connection है hand hygiene और respiratory system का? Yeah. Yes, very good. So like I said, when a person sneezes or coughs, they will release the droplets which will fall on the surfaces. If the person is positive for COVID, these droplets will contain the viable virus, and then what you will do, you will touch the surfaces, and then you will touch your exposed mucous membranes like eyes and nose or mouth, and then this virus will enter. Understood? Or if you are in very close contact, that is less than 6 feet, then directly these droplets are going to fall on your exposed mucous membrane and it is going to enter your body. So this is known as droplet contact transmission. Please understand the difference. So for droplet contact transmission, like which happens in SARS-CoV-2 mainly, we need to do the hand hygiene. Whenever you have touched a surface which is likely to be exposed to pathogens, you have to immediately do the hand hygiene. Okay, and social distancing, because these droplets cannot travel beyond 6 feet, that is 2 meters, we advise the social distancing, that is distance between two persons should be 6 feet. India में possible था क्या? Impossible. It was impossible. And what about the small droplet nuclei which are less than 0.5 micron? This is mainly seen in diseases like tuberculosis. So what is the use of social distancing? Suppose I am a patient of tuberculosis and I cough. These aerosols, they will remain suspended in the air for a long time. Gravity does not act on them. It will not settle on the surfaces. It will travel even till the person who is sitting on the last bench. So will social distancing help? No. How is the person going to acquire the bacteria, TB bacteria? By inhalation, not by contact. That is known as aerosolic transmission. Very small particles inhaled, they directly go into your lower respiratory tract and cause the infection. So for tuberculosis, your social distancing, hand hygiene is not going to work. There you need personal protective equipment like a N95 respirator and a good ventilation. Understood? So this ventilation can either be mechanical ventilation like artificial ventilation or a natural ventilation which includes open windows which should be crossing each other in front of each other. Right? So is this clear? What are the challenges you will face when you start experiencing the clinical side of medicine? So these are the pictures. These are the numbers from the last few years. And not just India, look at this. This is still old data. Newer data there will be increase in this. So many healthcare workers were positive and died as well. 573 from India. It went up to somewhere around 800s or 900s. Understood? In the third wave, there was not much of mortality, but morbidity is there. Don't think COVID से मरता नहीं है ना आदमी तो क्या टेंशन है, but there is significant morbidity. Morbidity means some kind of dysfunction, whereas mortality means person dies. Okay, so morbidity is equally important. And not just India, but even in the developed countries, these are European figures, 17,000 plus healthcare workers died in 2020 due to COVID. You know, in the first wave, Italy and all were very significantly affected by COVID. So even the developed countries. And this person, does anyone know who is he? He is the first whistleblower Chinese doctor who noticed that in December 2019, there was many cases of severe acute respiratory distress, pneumonia with an unknown cause, and it did not look at as something he has seen for the past few years. It reminded him of 2003, in which there was a severe acute respiratory syndrome virus, SARS-CoV. That is the one. And he notified the authorities, but they did not take cognizance of it. Probably the country hid some facts for few months till by 2020 it became a global phenomenon. So he is the first whistleblower. So like I have been repeatedly telling you, we are at 12 times the more likely to be infected by SARS-CoV-2, which is the virus which causes COVID-19, than the general adult population. So these are some of the patients who have been lost during the COVID pandemic. So before COVID-19, when microbiology used to hold such sessions, क्या बोलते थे बाकी लोग, physician, surgeon, हाँ चलना है मालूम है, no importance. Then what? This has been happening since the last 150 to 200 years. Then came COVID. COVID's fear taught them more than what microbiologists have been teaching them for the last 150 years. Understood? The fear of COVID. And is this going to end? COVID chala gaya na? So neither has COVID gone, nor is the possibility of any new infection gone. These are known as emerging and re-emerging infections, which in the last few years has significantly increased. Understood? Emerging means COVID-19 is completely an emerging infection. It was never there before 2019. Whereas re-emerging is something which was present earlier, went quiescent for a time period, and then again now it is re-emerging. Like you must have heard about measles cases erupting in Mumbai, or Ebola, which keeps on coming in the African countries every few years. Monkeypox, which was present there few years back, now suddenly in the European countries they started getting lot of monkeypox. So these are re-emerging, whereas COVID-19 was a emerging illness. So more our proximity with the wildlife and other such areas, there is a likelihood that most of them are zoonotic in nature. Zoonotic means originating from animals. Okay, so these type of infections are going to increase. So don't forget this lecture even after you pass first year or second year. So these are it is very evident. You don't even need any kind of controversy for this. It is, all of us know that you will acquire the infections while working in the hospital setting. Most of them will be bacterial in origin and some will be viruses, etc. So common infections which you might encounter is tuberculosis, HBV, Salmonella, HCV, etc. Okay, so what do you mean by biohazard? It is due to a biological agent and has the capacity to produce harmful effects on humans. So examples are the microorganisms, toxins derived from these microorganisms, and genetically engineered biological substance which may be used for something known as biowarfare. So COVID is thought to be one of them. I don't know, we cannot comment. There is no evidence per se, but it can be a biological warfare agent. So what happens is, because we don't see these organisms, that is why we don't take precautions against them. It's very simple. As I said, if you enter a local train which is packed and you see an empty seat, you go rushing there, but invariably there will be something like someone has vomited, etc., or some dirt on the seat. That is why the person is not sitting there. Imagine the moment you start seeing these organisms. Whenever a person is coughing and or sneezing, you start seeing Mycobacterium TB aa raha hai mere paas, or SARS-CoV-2 is coming towards me. Then you will start avoiding. Otherwise we don't. Right? So you have to keep that in mind, that everything around you in a clinical setting will be potentially infectious. Even SARS-CoV-2, although we say that it spreads by a touch or droplet contact, in certain settings it spreads via the aerosols. So especially when you are doing a procedure which generates aerosols, we will see that later. So biosafety is the theoretical part, that safety from the biological hazards. But what is more important is the practice. सिर्फ theories पढ़ाई किया, MCQs किए, NEET PG crack किया, नहीं चलेगा. You have to practice as well. You have to put into practice whatever is being taught to you. Okay, so good practices that reduce the risk of exposure to biohazardous substance is more important than just knowing about it. Whatever we are teaching, you should implement it, especially when you become interns. तभी नहीं follow करते हो. So what is risk? Risk है तो इश्क है. बराबर है ना? So is that it? So risk is the probability of a harmful effect as a result of exposure to hazardous substance. So just the hazard being there is not enough. Hazard will always be there. Once from the second onwards, when you step into the clinical area, there will always be hazard. Please understand. Can a soldier say, I will not fight on the border, मुझे गोली लग सकती है? So hazard will always be there. Similarly, you will be the soldiers defending the patient. So there will always be hazard near you. what you need to do is to reduce the exposure. समझ रहे हो? You are fighting that hazard itself, na? You are fighting those infections, and there will always be these pathogens in the clinical setup. So simple example, you can see shark in the ocean. Is it a hazard? Yes. But what if you are seeing the shark in the aquarium from the other side of a glass? No risk. Barabar, risk is zero of the shark attacking you. But when you get exposed, you dive into the ocean, then the risk increases. So the risk is function of the hazard and exposure both. When you get exposed to the hazard, the risk will increase. So your duty or your responsibility is to reduce the exposure. And there is one more component, which is vulnerability. I have dived into the ocean, another person has dived into the ocean, that person can swim fast, I don't know swimming. Who is at more risk? Me, because I don't know to swim, because I am vulnerable. Understood? So not just hazard and exposure, but also the vulnerability. You should always remember this point. Why? Because when you become interns, अरे मेरे को कोविड ड्यूटी लगाया, इसको नहीं लगाया. You have to understand that some people may be more vulnerable than you are. They might have some respiratory illness. They might have diabetes mellitus. If it is a residency, there might be pregnancy as well. There can be any kind of vulnerability. There are so many vulnerable states who need to be protected from the hazards. So give that due consideration. Risk will be hazard into exposure into vulnerability. Especially this happens with employees, because then after some years they start developing, some of them have diabetes, mellitus, etc. So even then you should keep this in point. So which of these two specimens is a greater risk? One is urine, one is blood. What do you think? Blood is a greater risk, right? So it also depends on the procedure. Please understand. I have not told you what to do with this. If I tell you, you plate this urine into the culture medium, and if I tell you just inspect the tube from outside whether it is leaking or not, without touching, no risk. But urine, as soon as you open the container, there is a chance that there might be organisms which are coming out. So higher risk. So in theory, yes, blood is more risky, but it also depends on the procedure you are going to do or what you are going to do with that particular specimen. So hazard and exposure. So what can be the hazard? Either the agent hazard or the procedure hazard. So like I said, some procedures like centrifugation create lot of aerosols. Understood? So the risk will be much higher after you have done centrifugation. Some procedures, there might be no need to open the container, just seeing whether the quantity is sufficient or not. So no risk. So what do you mean by agent hazard? You should understand what is the agent in question, what are the source of its infection, what are the modes of transmission, does it cause the human disease? And what is the infective dose? Infective dose means minimum amount of that organism which needs to enter the body to cause the disease. So smaller the infective dose, the more likely the disease will be produced in the body. Like some of the organisms which you will hear in the next year, like Shigella, etc. These have a very small infective dose. So in some food material, even if small amount of this bacteria is present, you will get dysentery. Whereas Vibrio cholera suna hai? Vibrio cholerae, this has a very high infective dose. It requires almost about 10 raised to power 8 bacteria per ml of the food to get the disease. Understood? So that's a huge infective dose. So that is also an important factor. So what is the agent in question? Obviously, if you are working in a TB hospital versus a general hospital, like KEM is a general hospital. You have a Shivdi TB hospital, Suna, it's just next to our hospital, just a few miles away. That is a completely TB specific hospital, tuberculosis. All the patients who test positive from KEM are shifted to the Shivdi TB hospital. So, greater number of TB patients, so more source, more hazard, more risk. So, they have to always keep in mind about following the aerosolic transmission. HIV versus HBV, hepatitis B virus, that day I told you, hepatitis B virus is much more transmissible than HIV. 30% chance of getting HBV after you get a percutaneous injury, that is needle stick injury, as opposed to 0.3% chance with HIV. Swine flu versus seasonal flu. Seasonal flu is influenza A. Swine flu is also a type of influenza A, H1N1 strain, or H5N1 or H3N2. These are some strains. So these tend to cause the more severe disease, especially in children and the elderly or person having pre-existing lung conditions like asthma, etc. Understood? So these strains are more dangerous than the seasonal influenza, influenza A. HIV versus Ebola. Ebola is a viral disease which keeps on coming in the African countries after few years. Thankfully, it has not come to India yet. It is a very dangerous disease. The mortality is as high as 70% in Ebola. If a person gets Ebola, then chances of dying are very high and it is highly contagious. No relative used to even bother cremating the bodies of the patient. The doctors themselves had to wear PPE and dig large holes and put the body inside. Okay. So like I showed you, the source of infection in tuberculosis will be whenever a person of tuberculosis coughs, sneezes and talks. In HIV, it will be the blood and body fluids of the HIV positive patient. This you should know why, so you know what kind of precautions to take. So these are the various methods by which organisms are transmitted. It can be contact, direct skin to skin like fungal diseases, droplets like diphtheria, mumps, rubella, pertussis, influenza, common cold, SARS and SARS-CoV-2, and aerosolic, TB, measles, herpes zoster, SARS plus SARS-CoV-2, etc. Needle stick injury, blood-borne pathogens and ingestion. So currently there is also conjunctivitis going on. So if you have the habit of touching the surfaces and rubbing your eyes, there is a possibility, like she is already doing, there is a possibility of developing conjunctivitis. So ऐसे नहीं है कि वो लाल आँख देखने से सामने वाले को हो जाता है. And that is a very common misconception in the general public. अरे इसको देख मत, इसको एक तो गॉगल पहना देते हैं. That is because they have some kind of photophobia also. And उसका आँख को तो देखेगा तो तुझे भी हो जाएगा. No, it is actually spreading through the surfaces. So if a person is having conjunctivitis, that person should wash the hands properly and also those who are staying with them, and wipe the surfaces every 4 hours with either soap and water or disinfectant. Identify this scientist, very famous scientist. Bruce Banner. What is the contribution? So is he a risk? Is he a risk? Dr. Bruce Banner, is he a risk? What risk do you have? Probably not. What happens when it turns? Now is there a risk? Yes. So why you should know the agent risk groups? So some agents are risk group 1. So the probability that they will cause human infections is very low. Community risk is very low. These are, example are plant pathogens. So you need not worry about them if you are researching. You will not encounter those in your MBBS. Second is the most common kind of pathogens which you will encounter will belong to the risk group 2. They may cause human diseases. Most of the diseases will be not serious, treatable. Individual risk is there, yes, moderate, but community risk is low. Like a methicillin resistant Staphylococcus aureus abscess you will get, or a wound infection. Will it rapidly spread to community like COVID did? No. Understood? Most of the organisms which you will encounter belong to the risk group 2. Staphylococcus aureus, E. coli, Klebsiella, all this you will learn in the next year. Third risk group, yes, they will cause human disease, very serious respiratory agents, but they are treatable or they have a good vaccine against it. So individual risk is high, but community risk is also there. Like classical example of risk group 3 is tuberculosis. Tuberculosis is a very big problem in India. It is a community problem. An untreated TB patient will spread it to 12 to 15 more people in an year unless treated on time. Okay, so it spreads. India has the largest number of cases of tuberculosis in the world. And our aim is to eliminate tuberculosis by the year 2025. According to the National Tuberculosis Elimination Program. Whether it happens or not, that is another issue. Do you think it will happen? To 2023 aa gaya. 2 saal hi bache hai. As long as people are spitting on the road, it is impossible. Fourth is yes, it causes the human infections, very serious, often fatal infections, and no treatment is known till date. These are highly dangerous organisms. And the community risk is also high. Classical example is Ebola and Marburg. There is still no treatment over Ebola. Why you need to know this? Whenever you are going to handle such cases, you need to know what kind of protection you should have. Understood? If you are going to the OPD, then you might not need that much of protection. But if you are going to see a suspected Ebola patient, you have to wear a positive pressure suit. Not just the PPE kit which I showed you, the coverall suit. It is a positive pressure suit in which there is air from the inside. Positive. So any pathogen which is coming towards you will be pushed outside. Understood? So if you are suspecting a very new infection, like what happened when COVID just started, no one knew how it spreads. No one had the treatment, proper treatment for it. कोई हाइड्रोक्सीक्लोरोक्विन देके देख रहा है, कोई जिंक दे रहा है, एजिथ्रोमाइसिन दे रहा है, डॉक्सीसाइक्लिन दे रहा है, रेमडेसिविर दे रहा है, टोसिलिजुमैब दे रहा है, मालूम किसी को कुछ नहीं है. Just roll of dice. So that time when COVID came, it was in the risk group 4, then it came to risk group 3. Now because it has a good vaccine, probably it is somewhere around risk group 2. Understood? So what are the persons and procedural factors influencing risk? Like I said, immunosuppression, illness or disease, pregnancy, allergies. Please give them consideration. Don't think मेरे को 2 महीना COVID ड्यूटी लगा है, अभी तो COVID नहीं, some another disease when you will be interns, और इसको नहीं लगाया. So these are some of the aerosol generating procedures which I told you about. Where you will be in direct contact with the respiratory system of the patient. As soon as you establish connection with the respiratory system, what will happen? These droplets will come out. So any room in which you expect such aerosol generating procedures to happen, you need a good ventilation, you need your personal protective equipment, and that personal protective equipment has to be a N95 respirator, not a cotton mask, not a surgical mask. Is this very clear? Understood? So if you are going for a bronchoscopy room, patient might be, obviously patient has come for some respiratory problem, right? Since you are undergoing bronchoscopy. So there is a high likelihood that patient is having tuberculosis or COVID, and you are going to do the bronchoscopy. So immediately these aerosols are going to come out and you will breathe them unless you wear a proper fitting N95. Like I told you, you have to check for the seal test. You have to press the nose clip and you have to puff outside. There should be no air leakage. If there is air leakage, there is no use of that N95 respirator. You are going to inhale those aerosols anyway. And there is something known as air changes per hour. That is mainly the engineering point of view, that the whole volume of air in a particular room is completely replaced by fresh air. That is one air change. Samajh? So whatever we have exhaled right now is present in this air, and when completely new air will come, it comes to these ducts. So we have artificial ventilation for this room, even the ACs. Problem with ACs is they recirculate the air. So whatever we have exhaled, it is again being dragged by the AC. Without, some ACs have filters. Without filtration, it is pushed back after cooling it. So that recirculates the pathogen. So when COVID came, you know, many were advised to keep the ACs off because of the recirculation. Another is the ambu bag or intubation. So if you are posted in the emergency services, do you have the time? Patient आया, फिर मैं N95 पहनूंगी and then I'll see? No. You don't know which patient may require intubation at which time. Some trauma case may come, some another respiratory distress case may come. If you are in ICU, you may need intubation immediately. So prefer wearing the N95 in such situations rather than retrospectively regretting it. You may not get a case in one shift. तो ऐसे बोलने का नहीं, मेरे टाइम पे तो आता ही नहीं है, तो क्यों मैं N95 पहनूं? You may get it anytime in any shift. So can the biohazard risk be reduced? So like I said before, biohazard risk can never be made zero. You cannot eliminate it completely. But your goal is to bring it as close to 0% as possible. 1% is a small amount. Everyone agrees? 1% छोटा सा है ना बात. कल तुम्हारा पायलट बोलेगा मेरा 1% चांस है क्रैश करने का, चलेगा ना? 100 बार प्लेन चढ़ाएगा, एक बार क्रैश कर देगा. So understand that. Your aim should be to come as close to 0% as possible. So what are the principles? Risk assessment, like I said, you have to see whatever procedure is being done and assess. This your seniors or whoever is responsible will do. Like in an ICU, how much of a risk my intern is having, my resident doctor is having. Should I give them enough N95s? Because I know in ICUs, anyone can require intubation at any time. There are likely to be patients having pneumonia and other respiratory conditions which are going to release the aerosols. In a casualty, I know that my intern might need to do intubation immediately. Or in the bronchoscopy room, I need to provide them proper N95. That is the risk assessment. I know this person is suffering from asthma. I will not give the person COVID duty. I know this person is suffering from diabetes. I will not put them in a TB ward. Diabetes is a risk factor for development of TB disease. Okay? So that is your risk assessment. Containment means not allowing the pathogen to spread. Like biomedical waste we learned yesterday, even your reduction of aerosols. There are some procedures by which you can reduce the aerosols. And personal protection. So what is in your hand is mainly the personal protection, which I taught you during PPE, donning and doffing. So you need to know how to use it properly. Trust me when I say this. Abhi mundi hilate ho, sab kuch रहता है, but when you start practicing, you do not practice what is being taught. And then you land up in trouble. When COVID came, before COVID, like I said, we used to hold sessions. Chal, humko malum hai. And when COVID came, when microbiology was doing 1,000 RT-PCR samples per day, even had night duty, then they remember, अरे micro इस पे lecture लेती थी, N95 कैसे पहनना है, please अभी ले लो. They did not know how to wear N95. They did not know how to wear a coverall suit, the PPE kit. When we were teaching, they did not attend. जब COVID आया, तब सिखाओ. We did not have time. Understood? So you have to be always prepared and have a sustained preparedness for the next pandemic. You have to do that. Pandemic aate hi rehne wale hai. Clear? So what is biocontainment? Prevent the dissemination of biohazardous agents. Purpose is to reduce or eliminate exposure outside the environment to hazardous substances. This is how we break the chain by biocontainment. Even engineering is important. Like I said, the ventilation. If the ventilation in a bronchoscopy room is not good, your N95 is only protecting you to the 95%. That is why it is called as N95. It's a non-oil based aerosol protection up to 95%. Understood? So you need all your checklists to be proper. Ventilation should be good. Personal protective equipment should be good. Then only you can eliminate the biohazard risk. What is biosafety? Application of practices and procedures. I have written lab because we generally teach this to the lab personnel, but this also applies to the healthcare institutes and doctors. Designed to protect human health and prevent the release of pathogens into the environment. Respiratory etiquette, non-existing in India practically. What you should do is, whenever you get the urge to cough or sneeze, you have to cover the nose and mouth by something. It can be a tissue paper, it can be your personal handkerchief, or what you will prefer is the elbow. Not the hand. Why not the hand? Which we commonly do. हाथ से करते हैं ना generally. Why not the hand? Because once you cough or sneeze into the hand, you will touch the other surfaces. If you are using hand, you have to immediately do a hand hygiene so that you do not transmit. Okay. So, what you will see on the streets or most of India, no, zero respiratory etiquette. खांसी भी बिना कवर किए करेंगे, छीकेंगे भी बिना कवर किए, और रास्ते पे थूकेंगे भी पूरा आवाज साउंड इफेक्ट्स के साथ. So you have to tell these people to stop. It spreads a lot of diseases. Understood? What is the difference between a surgical mask and respirator? I've told you this, na? Respirator, yeah, bolo. Aerosols, yeah, very good. So, personal protective equipment, N95 is more of a personal protective equipment which is protecting yourself from the aerosols. Whereas, surgical mask is mainly for prevention of the droplets from going into the environment from your side. Understood? What we had few months ago was universal masking. That is a different concept. Yes, that time everyone needed surgical mask. But why we are telling you this? Because there is a rationale for everything. How many of you have worn an N95? So it's very difficult to breathe inside an N95 for a long time. Understood? So अगर तुमको terrorist से डर है तो bulletproof jacket डाल के घूमोगे सब जगह पे? Not feasible, right? Similarly, in a non-clinical settings, if you don't wear N95, it's okay. You can wear a cloth mask, you can wear a surgical mask. But wherever aerosol generation is expected, like a bronchoscopy room, like emergency services where anytime intubation can be done, can you afford wearing a cloth mask or surgical mask? No. This is the only emphasis I want. There you have to wear an N95. If you are wearing an N95 in a classroom, it's good. If you can tolerate the breathability, it's good. But you cannot do the opposite. You cannot go with a cloth mask into the ICUs, into the emergency services, etc. or the bronchoscopy room. So always remember, surgical mask is mainly to prevent the droplets from falling, whereas this N95 respirator is for our own protection. So does anyone know this scientist? Left side. This is, you might not know this. This is Dr. Ignaz Semmelweis, father of hand hygiene. So this person had suggested hand hygiene about 170 years ago. What he had seen was in the hospital he was working, the deliveries which used to be conducted by the nurses, there was less rate of puerperal sepsis. That is the sepsis which occurs after childbirth. Whereas the deliveries which were conducted by the doctors, there was more percentage of sepsis in the mother afterwards, after few days. Understood? So what he saw was the nurses had a very good hand hygiene practice. They used to wash their hands properly.